Welcome and thanks for joining us for today's HIS Talk webinar, 19 Massive Best Practices We've Learned from 4 Million Telehealth Visits. It's brought to you by Mend. I'm Lori from HIS Talk and I'll be moderating. We have two speakers today. First up will be Vladimir Negron, who is the head of demand generation at Mend. Joining Vlad will be Matt McBride, who is the CEO and founder of Mend. And with that, I'll turn it over to you, Vlad.
Thanks, Lori. Great to be here. Matt, as always, great to have you run through and have everyone learn a bit more about telehealth and, more importantly, all of the learnings that Mend has had. We had a great 2021 in terms of number of telehealth visits, and we're going to go through a few items to start off in terms of the agenda. We will run through why is telehealth and patient engagement important, followed by running a productive telehealth program, how to simplify operations and help more patients. And as Lori mentioned, at the end, we'll have a question and answer segment. So please, during the webinar, as questions come up, fill out that questions box so that we can answer them at the end. So to start off, telehealth and patient engagement, we understand often go hand in hand, and one way to frame this is how it is to evaluate the value propositions for the stakeholders. Matt, there's different stakeholders and different value props to go through. Can you walk us through some of those differences and the perspective of the key stakeholders?
Yeah, and for today's conversation, we'll really be focusing on telehealth, but just thinking in terms of telehealth and patient engagement as well. I mean, for the patient, with telehealth, I think there's a lot of convenience. They don't have to travel. There can even be more flexibility in terms of scheduling appointments with providers that maybe allow more flexibility in their schedule. So, definitely increased access. There's a lot of wins for the patients. For clinicians, I think in a lot of cases we might see higher compliance rates. They're able to have more flexibility potentially in their schedule. Eliminate free work, other types of benefits. So definitely a win there. And then I think in terms of the leadership of an organization, reduce no-shows. Revenue obviously being important. I think having that convenience and things that patients are looking for can improve loyalty, retention. So there's benefits across the board, and it's really a win for all the stakeholders involved.
Now, Matt, telehealth adoption, we're seeing that it often comes down to satisfaction. So to frame it a different way, if patients or providers don't like it, then it just won't have much impact. We have a study here, a telehealth impact study here from Healthcare Coalition. What are you seeing that the data is saying about how telehealth is currently being received?
Yeah, I mean, there's all kinds of organizations studying this, from banks and trade associations. I mean, there's a new study coming out every day, it seems, around physicians, around patients and consumers. So during the pandemic, a healthcare coalition was formed to start to gather data so the government could make a decision in terms of long-term legislation for telehealth, which we'll touch on a little bit in the presentation here. So lots of groups, unpaid, were collecting data during the pandemic and the use of telehealth. And so a lot of interesting conclusions, and I think this is pretty consistent across all of the different studies that, for example, 73% want to continue to use telehealth in the future. 83% believe that the quality in the communication was good. 79% were satisfied with the care in the telehealth visit. And then on the physician side, 68% of physicians felt like they would continue to use telehealth. it was really used across every kind of specialty and every kind of care as it basically went mainstream overnight. And then I think, a lot of interesting observations around, this is something patients are going to look for, these types of conveniences when they choose their providers. They're going to look for these types of conveniences and kind of see this in the data across different studies, or would consider switching. So it's obviously something that's important to a lot of patients.
So now we're going to transition into the meat of the webinar, the 19 telehealth learnings and how organizations of all sizes can run a highly productive telehealth program. For learning number one, setting clear goals. Telehealth is extremely powerful when organization can set clear goals. But Matt, explain why that is, and what are some of the key goals that people should be reviewing when they're creating that initial process?
Yeah, I mean, this seems commonsensical, right? And so I think there's really two things to emphasize here. The first is we put a lot of the goals that we see from customers on here. So I think one of the number one reasons for implementing telehealth is to reduce no-shows and really to maximize productivity. But there's lots of other reasons and lots of other goals that organizations have, from maybe expanding geographically faster, expanding business hours, eliminating free work. It can be used to attract and retain providers, so on and so forth. But I think what's really important here is to establish the goals and metrics, and that needs to start when you're looking at solutions, carried through to implementing a solution, and just make sure the goals are always front and center, even long-term, years into the program. Are we meeting and achieving the goals, and make it clear with the vendor that you're working with too, so they can help you achieve that goal and be successful.
So once the goals are set, move on to the next step. We know that telehealth isn't for every type of appointment. What are some of the common problems and types of visits organizations can leverage with a telehealth protocol while they're developing that, Matt?
Yeah, I mean, so I think first and foremost, when is telehealth safe to use with patients, right? And so here's some examples that we see from customers. So first, on the problem side, maybe looking for areas or certain appointment types where you have high no-show rates, or where compliance drops off in perhaps a treatment plan. Of course, pandemic and infectious disease concerns. You might have folks that have, transportation or other barriers to care. And then the types of visits, medication management, follow-up lab results, et cetera. All those types of visits where you don't have to physically put hands on somebody could all potentially be a fit for telehealth. But really establishing this protocol in your organization, when and where are we going to offer telehealth safely to patients, is a key area when developing a successful program.
Let's keep on running through that, Matt. So other keys to success when establishing a telehealth program, organizations should be examining some operational considerations from one end to the other end. What are some of the key considerations that our listeners should be looking out for?
Yeah, and so we're going to dive into some of these more specifically, but I think you want to start thinking about from marketing all the way through to billing and any follow-up. So anything, after the visit, during the visit, before the visit, you want to think through everything. So how is staff going to schedule? Do we need to have certain appointment types? how do patients, book appointments? Is there anything in terms of integration we want to set up to create some automation, all the way through to providers and other folks that might be involved, and finally to billing. So we'll definitely get more into some specifics here, but you want to think all the way from start to finish, every touch point with the patient to consider operationally.
Now, Matt, we know that the public health emergency isn't going to last forever, and that's a good thing. But as it relates to our listeners and starting a telehealth program, how should organizations that are trying to stand up this program think about things such as legal issues?
Yeah, I think one of the big questions is always regulatory. What is the government going to do? Well, there's great news. The government has already extended the telehealth waivers 151 days past the public health emergency. So waivers were passed. They were in effect as long as the public health emergency was in place. Now there's a 151-day extension. Why is there a 151-day extension? Because they want to have time to develop something permanent. So this is not going away, it's permanent. So I think you want to get prepared. If one of the best ways that we've seen to just solidify telehealth is working directly with your payers in those contracts. We've seen plenty of organizations prior to the pandemic in states where laws were not favorable work with their payers, have equal reimbursement added to contracts, and moved forward regardless of the state laws or federal laws. So if you just want to get everything buttoned up today, payer contracts is the best place to start. State laws can definitely be important, specifically if you have high populations of Medicaid, so on and so forth, or you want to dive into specific rules and regs around what you can and can't prescribe. The Center for Connected Health Policy, that's a website you're going to want to follow. They have everything broken down state by state at the federal level. They send email updates out. So if you're not following that website, you definitely want to take a look at that website, and they'll provide summaries and links to the actual rules and regs, whether it be at the state level or federal level. And then finally, there were waivers that were allowed for telehealth that you didn't, that you could use non-HIPAA compliant applications like WhatsApp or FaceTime, things like that. I mean, I would plan that is going to expire. And you'll definitely want to start thinking about, if you haven't already, and we've polled folks, and there's definitely a high percentage of folks out there using non-HIPAA compliant solutions. Now is definitely the time to start moving in that direction and making sure that you have a compliant solution in place for the long term.
Speaking of being compliant and having the right kind of technology, coming here to learning number 5, Matt, prioritizing technology and IT. Can you speak a little bit more to why everyone needs to not just be thinking about long-term, but also flexibility?
Yeah, so I think for the most part, there should not be a huge technology lift. And I think that's really one of the key learnings here in this slide. A vendor like Mend is going to be fully HIPAA compliant, SOC 2 Type 2 certified, and help with all of the other potential areas where different regulations will come into effect. For the most part, you can use all of your existing equipment, as long as they have cameras and microphones, which, pretty much every device has had for a long time now. We will work with providers and test everything, and we'll get into the provider side a little bit more specifically. So there could be some minor changes needed on the network, or if you use a VPN or things like that. But an enterprise vendor like Mend or like Mend will, be able to help you get all that ready to go. And then also you want to think through about support. It is technology. If somebody does have an issue, what do they do for technical support? Is there a help desk in the organization? Or do you look to a vendor like Mend who provides instant support within 15 seconds to patients, staff, or providers? So you want to think through support needs as well for the organization.
Thinking everything through is key here. If the listeners are catching on, Matt, you're coming to learning number 6. We at Mend see that the more productive organizations look at different touch points, and they do that first and foremost by creating a scheduling script. Can you speak a little bit more to why they do this, and what are some of the key areas that people typically do when creating such a script?
Yeah, I think this learning comes from setting expectations, right? And if I was going to come into a healthcare organization to have some outpatient procedure, I would probably get a list of instructions, what I can and can't eat or drink, or things I need to do so that I can come in and have that procedure done, right? The expectations are set in advance. Well, with technology, when you're scheduling somebody for a telehealth appointment, that's a great opportunity to set somebody up for success for a telehealth visit, especially maybe somebody who's new to the practice or hasn't used the technology before, or maybe you're now making a transition from something non-HIPAA compliant to something that is. So, you want to make sure you get the email and mobile number so you can get them links and get them reminders, make sure they have the right equipment, a good device, internet, quiet location. We have different consents and things that we will provide for best practices. So giving people a heads up around that, maybe expectations around how they'll join. They'll get a reminder, they'll click the link, enter their date of birth. They could experience a short wait. And then maybe any other tips to have a successful connection around, having strong internet, closing other programs that are running. Headsets are much better to reduce any echo, maybe have the device plugged in. So that point of scheduling in advance of the visit is a great place to set expectations, set that encounter up to be successful.
Let's talk a little bit more about that physical space that you were just alluding to, Matt. We know that these days providers can conduct a virtual visit from anywhere. So how should a provider's physical space be addressed, especially for those that might be conducting visits from their home office?
Yeah, so just from different customers and examples of Mend, providers are busy. So they may not always really participate in training, and sometimes their training is on the fly once you've you've sort of gone live with everything. And as much as we coach customers away from this, or we have resources that will train providers specifically, we can provide on-demand training. We have tech support that's available. We have a provider success team that will work with them in advance to test everything. As much as we have, that doesn't always happen with customers. And I think the point here that everybody needs to understand is that if the provider's side has an issue, it will affect every appointment. If a patient has a technical glitch, that's one appointment. But a provider's side of the equation here, if there is an issue, it will affect everything. So, they've got to be in a HIPAA compliant environment, whether they're in one of your locations or, remote at their home office, good internet, device. We want to check connections, make sure your VPN or firewall antivirus isn't going to be an issue. Headsets are great for providers to reduce any potential echo. And then, what do they do if there's a problem? What do they have a backup device? Maybe their smartphone. How does that work? How do they get support? So just keep that in mind, that the provider side is going to be extremely important to making sure that the visits happen and that there isn't a bad experience for the provider or for a customer.
Matt, we've reached the three-letter abbreviation portion of the webinar here. We've got SOPs, standard operating procedures. There's a few to consider when you're trying to build a telehealth program. What are some of the key ones that our audience should think about?
Yeah, so having documented policies and procedures that people can reference, so that something is documented to protect the organization, is going to be extremely important. Not just winging it or just allowing people to do whatever, having set processes and set policies to follow. So, for example, maybe around verification of patient identity, maybe you want to document the address of where the patient was located in case you were ever audited. You want to, the patient, for example, doesn't have to be in a HIPAA compliant location. If they wanted to be walking through the grocery store, they could. So training around that and just having everybody understand how HIPAA applies. Thinking through any sort of attire and having that documented. Any sort of training documentation, maybe on how you're going to connect translators into the visit, scribes. What do you do in emergency situations? So you want to just think about those key critical areas and definitely have standard operating procedures documented for the organization.
Matt, we know that billing for telehealth and virtual visits can be complicated. Walk us through a little bit of what some of the basics are and how there might be different approaches depending on how you're setting up the program.
Yeah, and so really everything was open up and with the public health emergency and kind of continues to remain that way. But there's probably there's going to be a pullback on some areas for telehealth as policymakers move towards permanent legislation. So you definitely want to follow the connected health policy. They have great updates around billing, explain everything for billing. So just sort of a quick overview of all the different aspects of billing around telehealth. First, you have the originating site. So if you were hosting a patient for a kiosk session and the provider was remote, there is a code for that. The place of service is important and has changed over the years. So during the pandemic, the place of service 2 for telehealth really became the norm where it wasn't before. The different types of modalities, whether it's video, audio, or some sort of asynchronous form of telehealth is important. The type of providers that can practice telehealth, depending on the organization that you have, there may or may not be some limitations there. Then you have the different services that you offer, and I think a lot of groups will use an E&M code with a modifier, but on the Center for Connected Health policy, and there's over 240 different codes specifically for telehealth, so becoming familiar with that could be helpful. And then finally, there could be a modifier, and we've listed some of the modifiers here, but 2 that just came out recently within the last couple of months. At the bottom there, real-time audio only, and FR for supervising practitioner. So this is an area where changes are happening, and so we wanted to provide an overview, but I think more importantly, you want to have a resource like the Center for Connected Health policy that can keep you updated as things change, as it's evolving quickly.
Codes and modifiers, got to stay up to date. Matt, for telehealth visits, we know that it's not just, or it doesn't have to be just basic video conferencing. There are many different types of workflows. Here's one that we're sharing with the audience. Can you walk us through this example that is commonly used?
Yeah, and we'll touch on some of the other workflows that are possible. But here's a scenario where we're mimicking an in-office workflow. So in-office workflows with a platform like Mend can be translated virtually. So first, we've got to have the appointment that's scheduled. That could be staff scheduling, could be the patient scheduling, as we offer a patient self-scheduling. And then, that can, if staff is scheduling it, perhaps that's flowing over from an integration. We would then send out all the appointment reminders. So we would send out the links, digital forms, consents. We would have the technical support, everything that's needed to get the person connected. We're going to send that out in advance. At the time of the visit, the patient would click the link, put in a date of birth, and enter our enhanced virtual waiting room experience that we'll touch on and the benefits there. Finally, you might want to have the staff, now it's time for the visit. So maybe somebody meets with them and checks them in and goes over everything. Maybe a nurse connects. So you can sort of set different statuses and then have sort of transfer from one resource to the next. So perhaps you do a check-in, you transfer off to the provider, and then maybe for the final step, it gets transferred off to a queue for checkout. Maybe any follow-up appointments are made, payments are made, so on and so forth. So you can really mimic in-office workflows if you wanted, as maybe your organization thinks about a long-term strategy for telehealth.
So what I'm hearing, Matt, is you want to stay flexible. You may even want to think of how to customize a workflow. Can you elaborate a little bit more of why that is and how Mend has risen to the challenge where a lot of other vendors are faltering right now?
Yeah, and I think workflow is really the key. I think that's where we spend a lot of time during implementation, is designing those workflows. And you don't have to settle on just one. You can have different workflows depending on the need. So for example, we were just talking a little bit about on-demand queues and visit transfers. So you can have different queues, you can transfer to, from one resource to the next. Then we have different kiosk modes. Kiosk modes could be used to load balance across multiple locations, set up, satellite kiosks in, shelters or hospitals or, other places to access patients. Kiosks could even be used if somebody doesn't have access to the technology, they could come in and still access a provider remotely. We have workflows for adding additional parties into the visit that we'll talk about. You may have group visits. So group visits could be an important workflow as part of your telehealth program. And then of course, we've got, just regular scheduled types of encounters or ad hoc visits. If somebody had something after hours and you need to do a visit with them after hours, we have ad hoc flows. We also have waiting room links to not have to worry about moving the schedule and worry about maintaining an integration. We have waiting room links where the patient can arrive at their scheduled date and time of their appointment. So there's a lot of workflow options available with a vendor like Mend.
Matt, we're going to move on to the next portion of the webinar where we're talking about operational ease of use and best practices. What are some of the tips, tricks, and best practices our listeners should be thinking about for their organizations as it relates to operations? And let's start off here with patients.
Yeah, so we've got a few good learnings stacked up on this slide here. So some things to think about: virtual walk-ins, maybe having some sort of on-demand offering, perhaps, an on-demand type of urgent care offering or some other type of virtual walk-in to fill any gaps in the schedule. That is something we're seeing more and more customers do. One recommendation that we make is that staff and providers should connect to every scheduled encounter. The reason being that Mend will automatically send a nudge to the patient to connect. So if a patient isn't connected, you connect, give it a minute or two, we'll send an automatic nudge out to try and get the person to join. We'll talk about some other ways to nudge and make more visits happen. A telehealth phone call reminder. This can have dramatic results in certain populations that maybe don't check their text messages or email that often. Making a phone call to their smartphone, setting expectations. Your visit's gonna start in 30 minutes. Get the text, get the email, click the link, enter your date of birth. If you need support, here's how you get support. So telehealth phone call reminders is something that Mend offers and can make a big difference in the right population. And then we touched on kiosk mode earlier, but definitely if you think about kiosks in maybe you have lots of different locations, you have one location that's a little behind and you've got some excess capacity somewhere else, kiosk can be used for that. Could be used for folks who don't have access to technology. So there's lots of potential benefits for kiosks, even just to have satellite locations where maybe you need to access patients remotely. So these are, I think, are a lot of sort of power user type tips, and definitely areas where we're starting to see more and more customers take advantage of this.
Okay, let's stay on that track of being a power user. We know that bandwidth is vital for virtual visits. How, in this example, how does Mend approach the issue of low bandwidth, and how does it stack up against others?
Yeah, so we are definitely seeing trends where patient connectivity is getting it's improving. It's improving quite a bit, as I think this is becoming more widely adopted, and really telehealth has become mainstream. But you want to be able to have a platform that can work on an extremely low bandwidth connection. Now, this doesn't mean you will never have a problem. There could be a glitch in somebody's internet. We've all seen it, I think, during the pandemic and during, on different sorts of platforms. So you want to make sure that you have a platform that can work on a low bandwidth, has backup options, audio fallback options, has support if you need it. So that's going to be a really important part of the decision-making process for what platform you go with long-term.
Matt, I'm seeing here collecting phone, collecting email address, and I know for myself, I don't even know if my doctor has my email address. So for the listeners, how should providers ensure that they're collecting the right kind of information, ensuring that they're communicating with their patients in an appropriate way?
Yeah, I think there are a lot of organizations that have put an emphasis on this. I think most of our listeners, you're going to have a phone number, and there's a greater than 90% chance that that phone number is going to be a mobile number, and you're going to be able to text. But just think about what 1% of patients might look like if you didn't have the right contact information for them. What would that do to revenue? What would that do, to the business? And so we still see it occasionally. So you've got to make sure, especially as you think about telehealth and patient engagement, that you have a phone number and email address for everybody. The email address, we get about 75% of the time we get an email address. So there's a missed opportunity there, right? Somebody might want to connect on their their desktop or laptop and might want to access email. You want to have redundancy in your reminders to make sure that the visit happens. And more, this is what consumers want. They want the communication to be through text and email. So while we have seen this improve over the years, you've got to have really strong policies and procedures to make sure you have a phone number and email address for everybody. We do still get appointments sent to us, and we don't have the contact information at all to reach that person to send them a link. So make sure you have really strong processes in place around this.
A provider's experience, Matt, when using a telehealth platform is important. But when we're looking at that, like, what is one of the ways that the best platforms are handling this while still keeping it easy for the provider?
Yeah, and so, we've seen everything from providers on 2 different devices, multiple screens, single screen, and I think a lot of providers like the picture-in-picture experience where they can connect into the visit, they can put the patient's video feed into a picture-in-picture mode. It hovers right on top of their screen. Probably the chart is where they'll be spending their time. They can move it around, resize it. It's incredibly easy to use. And this just gives the providers the flexibility to have a single screen experience if they need it, but be able to access all the tools, primarily the chart, notes, lab results, things of that nature. So I think this is a key feature that providers will adopt, be excited about, and definitely will make their lives a lot easier so they can always see the patient while they're doing their work.
Making it easy. That's where it's all at. Let's talk about nudging, Matt. You spoke about it earlier. Let's dive a little bit deeper. With nudging patients, we're seeing it's becoming a crucial part for reducing no-shows. Can you explain more about how Mend is improving its capabilities from last year to this year, and where we're going from here on forward?
Yeah, so there can definitely be a need to bring other parties into a visit. And so we kind of touched on, the nudge, and then you may need to just add somebody into the visit. So we have a tool and another that we'll discuss that makes it very easy to get somebody a link from within a visit so they can join. So one of the things you can use this tool is for patients. You can send them, a nudge to join. There's an automatic nudge, but you can send them, another nudge manually, or you can send another party a link, maybe a parent, somebody else, a translator, a scribe, somebody else you need to get into the visit. You have this ability to get a link out to anybody at any time and easily get other parties into the visit, or nudge the patient so we can make sure that visit happens.
Speaking of bringing in third parties into a session, how is Mend approaching and innovating the patient experience and the provider's capability when it comes to things like third parties, scribes, and translators?
Yeah, so these same third parties that we're discussing, or the patient, we have the ability to make a phone call to get other parties into the call. So you could call the patient to get them into the visit. Hey, it's time for the visit. I'm ready. Did you get the link? Can you join? So, we have this ability to send a link. We also have the ability to just make a phone call. Maybe you want to dial into a service that transcribes for you. Maybe you need to get a translator dialed in. I think that's a popular use case where we set up all of the languages on a speed dial. You've got the patient on speed dial. Maybe you need to get another parent in, a spouse, a guardian, anybody that you need to get into a visit. Or maybe this is just a backup option, right? The patient has a connection issue partway through. Okay, click them on the speed dial, dial them up, wrap up the visit. So that ability to make a call where the provider's number is masked, where we can connect somebody through a phone call and then merge them into a telehealth visit. This is an extremely popular workflow that has a lot of use cases that can really make things a lot easier for staff and providers to do what they need to do in the middle of a telehealth visit.
Matt, we reached the final learning here. Learning number 19 for the audience. Patient satisfaction, we know, is often a struggle when it comes to virtual visits. Can you explain one of the interesting and innovative ways that Mend has approached this coming into 2021 and how it's been improving patient satisfaction across the board?
Yeah, so I think the waiting experience for the patient is very important. We've always seen wait times. You know, it can be common to wait to see the provider. Those same wait times can translate into a virtual setting as providers are in demand and very busy. Across our entire platform, we see about a 13-minute average wait time. So is that going to be 13 minutes of somebody staring at a screen that says, you know, waiting for another party to join, or are you going to take advantage of that time? Now, one of the earlier slides, the Healthcare Coalition studied patient satisfaction for telehealth specifically, and they found that about 77% of patients were satisfied. Well, we ran a study internally. We had groups that did not have the enhanced virtual waiting room on, groups that did have it on. If it was not on, we would see satisfaction scores consistent with the Healthcare Coalition and many of the other groups that have published patient satisfaction ratings for telehealth. When we had the enhanced virtual waiting room on, and that was the only thing we changed, we would see patient satisfaction ratings jump up into about the 93, 94% range with the only variable that we changed. And I think the difference here is we're providing entertainment and educational content. So you can, we look at healthcare related TED Talks, learn about heart health, healthy eating, meditation. We have all kinds of content in there so that folks can do something while they wait, while they spend this time waiting. So to kind of put this in perspective, in 2021, we had 19 years of wait time in telehealth, 19 years of time. So you want to be able to take advantage of this time. You can upload your own content into this type of experience. You really want to think through, what are patients going to do when they wait? And if you do think through this, you're going to be rewarded with higher patient satisfaction ratings. You're going to be somewhere in the 90+% category, and you'll far exceed what we're seeing in other studies like the Healthcare Coalition. So definitely an important part of the experience to take advantage of. And Mend already has it built out for you.
So, ladies and gentlemen, we've completed the 19 learnings portion of the webinar. I know it's been educational for me. I expect it's been educational for you as well. Before we move on to the question and answer portion, Matt, bring us home and explain why it's so important for telehealth and patient engagement platforms to be not just fully integrated, but also customizable.
Yeah, and I think what we really want to emphasize is that Mend is a platform, and we are a platform for not only telehealth, but in-person visits, phone appointment types, where maybe you have providers that are going to the location of the patient. Any type of appointment type, Mend can be that single partner, that single integration We can provide a unified experience so that you don't have to have different vendors for all of these different solutions, and have to maintain those integrations and probably pay more and not have one kind of single experience to offer patients. So we can do appointment reminders and notifications for in-person or virtual, payment capture for both, patient self-scheduling for both in-person and virtual. We have an AI attendance predictor that works across any appointment type that's in beta right now. Telehealth, of course, we can do and provide all the workflows you could ever need or imagine for telehealth. We can provide digital intake forms. Doesn't matter what type of appointment it is, if it's virtual or in person. Two-way secure messaging we can provide. We have other types of features too, bulk notifications. So really anything you're going to need to implement a successful telehealth and patient engagement strategy, Mend can offer and be a single partner, single integration, single experience for you for that.
Great. Before we pass it off to Lori, and we're going to read some great questions, I did want to call it out to the audience. There's just a lot that we covered, and therefore there's a lot of different ways that hopefully are coming to mind of how you could utilize a platform like Mend. If you want a custom demo, roll through those specific use cases with us. You can go to mend.com/demo and get your own, sign up and get your own custom demo with somebody great on our team. And with that, I'll pass it over to Lori.
Thanks, Vlad. As he said, now we'd like to open it up to the audience for questions. As a reminder, please use the questions section in the GoToWebinar panel to submit them. The first one, Gary says, very interesting presentation, thank you. How is visit data aggregated across a provider organization? Do you have an analytics component in your solution?
Great question, Gary. We actually have another presentation and ebook on our website, mend.com. In the resource section, we have the 12 top KPIs for telehealth and patient engagement. And so we run through all of the metrics that we think are important, and all of those same metrics we do track and provide to customers. So give you some examples. Maybe you want to know your average wait time overall broken down by provider. We have stats around bandwidth, so you can look at providers proactively. We can identify maybe who does not have great connectivity, and that could be a patient, that could be a provider, that could be overall. We have no-show rates. We will track your contact profiles and who's unreachable or not. We track all of the connection times for all of the users. And I'm barely just sort of scratching the surface on the data that we have available. So it's likely that we would have the analytics and the data that are required. And then we've got another great piece of content on our website. In the resource section, we cover those 12 top KPIs and share our data so you have something to benchmark against.
Can you talk a little bit about what you see as the main things that help fend off patient no-shows?
Yeah, I think first, that is probably the #1 problem that organizations are looking to solve with telehealth. You introduce that convenience and sort of allow that flexibility for folks. They don't have to travel anywhere, so they save some time. So telehealth can be a great component. Allowing patients to self-schedule or allowing them to modify appointments can be great at reducing no-shows. We see a much lower no-show rate for patient self-scheduled, or just making it easy for them to reschedule or cancel can be helpful. Digital forms, getting that out in advance of the appointment, having it be easy so patients can start to engage and invest care, or, invest time in their care before they even arrive. That's sort of becoming the new appointment confirmation. That can be a great way to kind of know if they're going to come in or not, because if they've already, filled all their paperwork. We also have AI that can predict attendance, and then we can actually adjust their appointment reminders to kind of get them to tell us if they're actually coming in or not. So I think a lot of the solutions that Mend offers is really around helping groups help more people, reduce those no-shows, those late cancels, and allow providers to help more people.
Thanks, Matt. Can you talk a little bit about your vision for the future of telehealth?
Yeah, and we will have some upcoming content that will most likely be coming out in a couple months that will really go more in depth with this. But I think, really where things are headed is, a digital check-in process that'll get the forms, get payments, even collect vitals. All of this is right around the corner. Into actually having the encounter itself, and we're seeing technology that we're integrating with that is able to provide captioning, provide on-demand translations, and technology that can even chart and do all the note taking automatically for providers, to after the visit and having automatic payment capture. So I think there are a lot of tools and a technology that can create a lot of automation. And I think in a few years, we'll be in a place where providers are really just delivering care. They're providing care, they're building relationships, and the staff and providers are not having to do a lot of these administrative tasks that's causing burnout, shortages, et cetera. So that's where we see things headed, and we'll definitely be putting out some more content around that in the very near future.
Thank you, Matt. That was our last question, so we'll conclude the webinar. I want to thank everyone for joining us today, and thank you, Matt and Vlad, for the terrific and informative presentation. Attendees, watch your email for links to the recording of today's webinar, as well as the PDF version of the PowerPoint presentation. We'll also include a link to download Mend's latest ebook, 19 Essentials for Highly Productive Telehealth Programs from Millions of Telemedicine Visits, and that will go into more depth. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of your day.